Hey everyone, I'm here with Claudia Rossi, healthcare worker and president of the Santa Clara County Board of Education. We want to talk a little bit today about how COVID is impacting our farm workers, our food source, and what that looks like for us here in District 6 and across the city of San Jose. Welcome, Claudia. Thank you for joining us.
Jake, I am so excited to spend some time with you, and I have been very impressed in that with you, in that you have reached out to so many of us in the community, not only out of concern for the plight of people who don't have a voice, but in an effort to become fully immersed in the issues that concern our community. So I certainly want to thank you for reaching out and being so present and concerned about our community. I live in South County, I work in South County, and the opportunity to talk about our migrant families, the people that are working in the fields, that are working in food processing plants and packing plants. Their stories are not at the forefront of these discussions. So I'm so happy to be here and grateful to you for reaching out.
Like I said, I appreciate you coming. It is important that with the space that we're in now, we do as much as we can to educate the community about the different and complex facets of COVID-19's impact on how we live and work and who's affected. Who we already know there's a disproportionate effect of COVID-19 impacting communities of color, and that doesn't always get talked about. We want to make sure that, and I want to make sure as an elected official, as a leader in the community, that we know that if we're not taking care of people in South County, if we're not taking care of our folks that are vital to, our food chain, essentially, that it's going to hurt us. We've built that into the entire platform that I'm running on. It's about equity. It's about making sure that regardless of your status, your wage, that you can live, in our community and you get to be a part of it. And so that's why it's super important that we have these types of discussions. They're not always as prevalent. We talk about healthcare workers being on the front line for,
yes.
We talk about people at the grocery store, banks, the things that are open in terms of services directly to constituents that are doing okay, but it's those the suppliers to those services that also really matter for us. So I'll just start off, what is it exactly that you do, and what has been the impact that you've seen over the last 2 months here?
Thank you, Jake. And well, one of the things that I have appreciated, and I've been privy and I've listened to a number of the discussions that you've had with community members, and you just touched on something that's very important to highlight, and it's the following. When we go to the supermarket, we see the person that is stacking the shelves. We see the person that is ringing up our bill at the cash register. We see the person that is packing the groceries into the grocery bags or helping us to our car. And the point that you've made, which I think is really salient, very important, is that the people who grew the crops that make it to the grocery stores are the unseen workforce. And when you look at where they work and where they live, they're living in the shadows. They're living in labor camps, in migrant camps, with housing that is deplorable, substandard. Often, if anybody has ever taken time to visit migrant camps, they'll see that it's always off the beaten path. It's not easy to get to the places where the families that work in the fields live. So they're unseen, but we feel the impact of their work every day when we go to the supermarket and we buy lettuce and we buy cherries and strawberries. And so I wanted just to start with that I find it, for me, very hopeful to know that there is somebody that is seeking office that understands that at your core. And so what do? I'm a registered nurse. I work for a community clinic. I don't work in a hospital. I work at a clinic, a federally qualified health center. And these are clinics that provide services to the most impoverished members of our community. And so here in South County, even before COVID, the disparities that exist were not caused by COVID. They were actually now exposed and brought to the forefront because it has brought to the attention of people, well, how do we bring testing to certain communities, right? And what happens when people are exposed? Where are they? How do we reach them? How do we bring them services? Well, we put out the call on the internet. Well, there are members of our community who don't have devices. And if they are lucky enough to maybe have a device at home through the school district, they may not have internet. So these hotspots and the conversations about hotspots and access to the internet, these are discussions that were not being had before by the larger community. And so now we find ourselves in a world pandemic where the well-being of every single member of the community, members of the community we see, members of the community we never see, like so many of our migrant brothers and sisters, their health affects all of us. And so I have really appreciated the opportunity to talk about these disparities because we were not having these conversations before. And so what do? I mostly do management and offer services to patients who have uncontrolled diabetes. And those are patients that work in the fields. And when they're diagnosed with diabetes and told, well, you know, you need to eat vegetables, you need to have produce, well, they can't afford to buy the very produce that they cultivate as part of their work. And so the opportunity to talk to you about policy is great. And in reading about you, I also found that you have worked abroad in community development projects. And I'd love to hear more about that because I think that having somebody on the city council that understands the importance of building policy that acknowledges our differences in culture is very important. And so what did you do abroad? Because I'm excited that someone out there running for office has that background.
So I was a Peace Corps volunteer. I spent a little over 2 years, about 2.5 years, in a small village, farming village, 3 hours east of Marrakesh in Morocco, doing youth and community development, which is a very broad term that can really be pieced into any aspect of development. You know, I taught art and chess. I taught English. I did environmental awareness programs, worked with communities to get access to clean water, HIV/AIDS awareness programs, you name it, and we touched on it, which was a really cool experience because it highlights, like you said, that intersectional nature of what goes on in a community and whether or not it has the cultural intelligence to be successful. You know, most people would think, just like down in South County, that, you know, all right, let's just get everyone access to information the same way. Here, where we have stable internet, where, you know, community might be a bit wealthier, just put out all your calls on the internet. You know, there's no more, we don't do phones all that often. You don't hear of too many people calling to check in on residents. The residents are supposed to know what number to call if they need that one-on-one help. And then we realized, you know, access to internet is still a problem here. It was certainly a problem in Morocco when I was there, and we would use it as best we could, but that's not the way that most of the community communicated. And so being able to bring that into policy that we have here, really, I think it is both a culturally, socially responsible thing to do, but it's also fiscally responsible. I mean, we don't want to put programs in place that start and fail because they weren't culturally appropriate.
Absolutely. And I think that your work, particularly in raising awareness around HIV, my understanding is that the work that you did was sort of like the Promotora model, which means that you go into a community bringing information that you then empower the community to then become the credible communicators to the rest of the community. And so you're building capacity, you're going in, you're presenting your information, but then you're empowering people who will then go out to promote health initiatives among their neighbors, and then you leave because you've empowered them. They don't need you anymore. That's the goal. I wanted to hear more about that, the work that you did, because I think that applies greatly to what we're trying to do here around the challenges that COVID has brought about. Yeah,
I mean, the ultimate goal is build a resilient community. You know, you're trying to work yourself out of a job.
Yes.
And the way that you do that for the development process we went through, we call them counterparts, right? My Arabic is above average for most people in San Jose, California, but you know, when I'm immersed in a new culture, you do your best to pick up the language as you go. Very hard subject for me to navigate, even from just a language perspective, much less than from a culturally appropriate perspective. So you'd pull on people to do these presentations with you. It was, you know, me in the background making sure we were pulling graphics off the internet because I had, you know, access to the internet from where I was at, where some in the community might not. It was me going through the paperwork, doing a lot of the navigation of services that people just may not know existed. And so in that sense, it is also like a role as a social worker. You're just meant to come in, make sure that the resources that are needed, that are being asked of you, are there and available and understandable. You know, it's not like I went in and said, HIV is a huge problem in, you know, a small rural village in Morocco, because to be honest, it wasn't. But the community said, hey, we do this training every year. You know, we want your help to expand it to a new audience, to tweak the program for a high school audience. Like that was me working very closely with people. It was the same, you know, type of navigation when we did, you know, access to clean water, right? If we were to just pick any old spot and say, hey, this is where water is going to come out from, you go to it, you might miss the cultural divides between two neighboring towns. You might miss the fact that clean water was a role traditionally given to women, specifically young women, you know, 13 to 15, which meant if they did not have water close by, they were being pulled out of school so that they could go to water. And that impacts the community in a negative way as well. You have those parallels still exist here, right? I mean, in our, you know, farm working community, people are pulled out of school and, you know, just to make sure their families get by. So we've got a lot of work to do. It's called international development, but that's how you develop any community.
And I think that in our, when you look at the diversity of our community, certainly the lens that you bring to it will be key. And I'm thinking about what someone on city council can do, and what policies can be advanced to serve families that are in the fields and in the mushroom packing plants and picking the strawberries and packing the strawberries. I think where we have an opportunity is to address the needs of the children of those workers. And so just to give a little background about what the life of someone who works in the fields experiences every day, they start work at 4 a.m, a good part of the year. So their work day starts while most of us are still sleeping, okay? Yeah. So they report to work at 4 a.m, And oftentimes they don't get home till well after their children have gone to school, returned to school, and come home to an empty home. And so what policies can we look at that support families? If you're a city councilman, a city councilwoman, how about after school programs? How about programs so that when the children of the people who are working in these industries, they can have the peace of mind of knowing that there are partnerships with the city and the districts where an after school program can have nutrition, can have assistance with homework, can have an opportunity for those children to be in a safe environment. Because if they're not, then that's when we see children who become law engaged, because in the absence of mentors and that person at home who communicates with them, then who becomes the circle that surrounds that child? And so while in policy, you may not be able directly from your position as a city councilman to affect them, what can we do to work with the school district? And I know you have a lot of thoughts about that. It's youth development and empowerment is one of your many passions.
Yeah, it's traditional that we've always thought, all right, city takes control of this, and school board takes control of this, county takes control of this, and what we've come to realize is that policy just doesn't work that way, that community building doesn't work that way, that when there are areas that are underfunded and the city has the capacity to step in, improve funding just by a grant program. We know City of San Jose gives grants to schools. It doesn't have to be a school in city boundaries. It doesn't necessarily it could be expanded through policy to say we know that this affects our community as a whole. There are certainly after school programs, trade school initiatives, access to community college. Those are all things within the traditional purview of city council as well, that when we expand and spend in those areas, we see a return on our investment. We see the community being healthier. We see less impact on overcrowded school systems, better successful students. That all matters, right? And it can also happen in the district. We're a very unique district, primarily thought of as wealthy single family homes, and that we have pockets of undocumented communities. We have pockets of low income communities of color. 30% of the district is Latinx, and that looks very different when you knock on doors like I have from one neighborhood to the next neighborhood, because those programs are still missing even from where we are, right? And having the capacity to then care for those families as well brings everybody up. I think something that you touched on that is really important is nutritional health. We're in a space where food deserts, access to healthy food is a sign of privilege right now. It's a farmer's market with organic produce that's expensive, and then we end up, like you said, the very people that are helping produce that food can no longer afford it. How do we make sure we're advocating at the city level to have wage issues, wage theft, minimum wage violations, even for our undocumented, investigated, because that happens all the time. Across the US last year, we had twice as much wage theft as we did property theft. At some point, we have to look at our priorities and say, there are people that have almost nothing and they're being stolen from. So let's take a lot of our budget and make sure that that's not happening. A piece of our budget, make sure that's not happening.
And I thank you for mentioning that, because when you have a community that is working in these jobs that frankly no one wants, when you're asked to report to work at 4 a.m, to work in every kind of weather condition, and to work in conditions that are physically grueling, and you are a victim of wage theft, now what we are seeing is that those same abuses are happening in exposing workers to COVID because they're not being offered the personal protective equipment that we hear of. And so as a nurse, I'm very happy to turn on the television and see, you know, commercials that are honoring the work of nurses. And I keep thinking about the other essential workers, which are the workers from the migrant community. And quite frankly, seeing the strikes for workers from McDonald's that are asking, and we're asking for the simple and essential materials to keep healthy so they can continue to work in these facilities. And so that's the other part, that any industry that would engage in wage theft is also an industry that is very likely to not offer equipment to their employees that will protect their health.
Yeah.
So all of
Or
this is connected.
sick leave, you know, I mean, I'm sure you've
Yes.
heard people that get sick and they still end up going to work. Not only does
Exactly.
that impact the family that can't, and then the immediate people from that family, but if everyone was doing that, it'd be like us not following shelter in place regulations, and we would certainly see a spike in cases and deaths. And again, the space that COVID-19 has put us is really taking a step back and saying, how is our community so intertwined, and yet we've left so many people out for so long?
And that's a dangerous thing when you consider, if you have employees that work in these industries. Here in Morgan Hill, one of the Luz America, which is one of the local food processing, seafood processing businesses, about 36 to 38 employees tested positive for COVID. And so the question then becomes, if I know that I will lose my job if I'm sick, or if I know that if I don't earn a paycheck, there's no paycheck protection fund to help me, and I have to keep a roof over the head of my children and my wife or my husband, well, you know, I think I have it, but I'm going to go to work anyway because I need that paycheck just to eat and to keep my family from becoming homeless. And so those conversations around advocacy to make sure that the funds that were so freely given to businesses and big businesses and businesses that would have survived anyway, if those funds didn't trickle down to helping the people that are working in the migrant fields, in the food packing businesses, then we are all affected by that. So as it turns out, compassion makes financial sense.
Yeah.
And I know you have a lot of thoughts about that as well, because I know you've been out in the community just fighting the good fight and advocating for them.
I appreciate that. I mean, finances, this, for whatever reason, we built a society where finance is the center of it. And it's why I was doing a lot of work with the public banking and divestment initiatives over the last couple of years, because we lose so much of our community resiliency when we have a very top-heavy financial system, and it's costing us more money. I mean, if at the end of the day, everyone had the financial stability, the rental stability, housing stability to shelter in place for 1 month, you know, we could have been in a really clear space. It protected a lot of people in a short amount of time, and then figured out how to slowly, you know, build back up. We're going on 3 months now, and that's you know, not been the case. So when we take a look at policy in the long run, fixing some of these disparities like that COVID-19 is highlighting will only make us more resilient to the next thing. You know, if it's another economic downturn,
there will be.
If it's flood, if it's fire, those things are coming, and we can either continue to treat the scenario on an individualistic level, where the community is going to say, is my job ready. All right, my job's ready. Let's, not take any precautions everywhere else. I've got my paycheck, great, or my business is starting to thrive. We've got to switch that mindset to a community framework. And I'm excited. Like I said, this is an opportunity to discuss what that might look like, pin for people some of the intersectionalities that have not maybe been connected before to the health of our community. And so I thank you for jumping on, helping me highlight these. Because even though you're down in South County, Gilroy, what happens down there affects us. And if we're not in a space as someone had asked me, what do you do as a city council person? And if you look up, city council person, and the role, it is to make decisions on behalf of the city for the best interests of the city with your district in mind. Right? It's not to make decisions with your district as the utmost and all-ending priority, because we wouldn't work, right? You got to make sure that you're representing the voice of the community. I have to make sure that I'm representing the voice of the community, but there is a space where you're supposed to make decisions for the city as a whole. And that's why bringing in these conversations is going to be so important. And we look forward to working together. County Board of Education, city is starting to, like I said, look at trade schools, how we interact with our community colleges, how we interact with our local school districts, building relationships in those spaces so that we can collaborate, advocate, together on issues at the county level, advocate and educate one another on the expertise that we'll have in our positions. That's also going to be really important for me to do my job well and to serve my district well and the city well. So, hey, if someone has an issue, let me reach out to Claudia, because we have a connection. And the more we can do that, not just among us as elected officials, but as the community as a whole, the safer, the healthier we're going to be. So
thank you. And I am so excited about your leadership. I know that you are somebody that that does more than speak about the issues. You have lived your values in your work abroad, in your local work with youth, with discussing issues, and your study of the issues. That's what's been so impressive as well, that you are continuously reaching out to learn, to listen, to be inquisitive. And I'm absolutely delighted and excited about the leader that I know you currently are, and how you will leverage all of that to become really a dynamic city councilman. I look forward to working with you.
Absolutely. I definitely look forward to working together. So thank you. With that, I'll end it, and I'll pop onto the comments and answer some questions. I'll make sure, Claudia, if there are questions for her, that we get connected and help get those answers as well. So thank everybody else for watching, and we'll talk soon.
Thank you. Bye-bye.
Bye.